Hello everyone, myself Deepa Singh, working as Assistant Professor, Yangi School of Pharmacy, SGU Jaipur. Today we discuss about different pharmacokinetic models or those models who involve for pharmacokinetic study. In previous lecture, we already covered introduction part of this pharmacokinetic or definition of a pharmacokinetic and description regarding pharmacokinetics and different model. Means some classification part or different name of this model is already covered in the previous lecture, and I think one model is also covered, and some introductory part almost we covered in the previous lecture. Today we discuss about different pharmacokinetic model, which are the pharmacokinetic model and how it is responsible for the study of the particular drug. So this is a topic of biopharmaceutics and pharmacokinetic subject. We form 6 semester subject. Before starting this topic, you should know about basic object or learning object of this topic. In this basic object, first is introduction of a pharmacokinetic model. Means previous lecture we already discussed that pharmacokinetic. Today we discuss about pharmacokinetic model. So in this you know about introduction part or brief description regarding this pharmacokinetic models. What are the pharmacokinetic models? And different model including the definition and some example maybe, and different pharmacokinetic models including compartmental and non-compartmental model. These are the two models for pharmacokinetic. One is compartmental model, second is non-compartmental model. So you should know about this compartmental and non-compartmental model, difference between these compartmental and non-compartmental model, and how it is responsible of which one is better, or how you distinguish this compartmental and non-compartmental model. So all these things you know about in this compartmental model or in this lecture. Next is subtype and example of this model. This compartmental and non-compartmental model is further divided into different categories or different subtypes. So you should also know about this subtype of compartmental model, including example or subtypes of this compartmental model. These pharmacokinetic model. So this is regarding the learning objects. After this, types of a pharmacokinetic model. In this, we already discussed that definition part, and now we discuss compartmental model. In this compartmental model are called as empirical model. Means another name of compartmental model is also known as empirical model, or synonym of compartmental model is empirical model. And next is physiological model. This physiological model is known as realistic model, or another name of physiological model is realistic model. And third one is distributed parameter model. In distributed parameter and parameter model is also known as realistic model. And these are the different model for pharmacokinetic parameter. In this first is compartmental model. In compartmental model is analysis is the traditional and most important use to approach the pharmacokinetic characterization of the drug. Means largely or traditionally use old model, you can say that is compartmental model, and it is largely used to give a good characterized result and commonly used. And these models simply interpolate the experimental data and allow the empirical formula to estimate the drug concentration with time. Means with the help of this compartmental model, we calculate the pharmacokinetic parameter, and in this we use empirical formula or some equation to calculate the drug concentration or estimate the drug concentration. With the help of this experimental data or empirical formula, you can easily calculate the how much drug is should the different study of that particular pharmacokinetic model. And in this, depending upon whether the compartments are arranged in parallel or a series. So this is a very important parameter. This study is depend on your type, whether it is are in a parallel condition or in a series condition. So according to this parallel and series condition, you again divide into two categories, or this compartmental model is divided into two categories. One is mandatory model, second is catenary model. So these are the subcategory of this compartmental model, or subtype of this compartmental model. Since compartmental are hypothetical in nature and compartmental model are based on certain assumption, means you can see that these compartmental model is not 100% good. There is some assumption or some hypothetical nature in the compartmental model. So there is some assumption also. So these are the assumptions for this model. And in this, the body is represented as a series of a compartment arranged either in a series or in parallel to each other. and then communicate reversibly with each other. Means a major you can say description is depend on the series or panel of the model, whether this is in a line or sequence or in a parallel way or in a series way. So these arrangement is depend on series as well as parallel arrangement that communicate reversibly in a transfer. And next is each compartment is not a real physiological or anatomical region. Means every compartment have a different physiological and anatomical condition and reason, and these victorious or virtual one or concentration of this tissue or group of the tissue that have similar drug distribution characteristics. Means each compartment have a different anatomical or physiological condition, and in this there were friction or some virtual concentration or tissue group or tissue have similarity of distribution characteristics may be vary or blood flow may be vary. So in this, you should know about what is the difference between physiological and anatomical condition between these tissue and how the distribution takes place of blood flow of that particular drug or affinity of that drug to particular tissue or blood flow. So this is assumption necessary because if every organ or tissue or body fluid that equilibrated with drug is considered a separate compartment, means every organ and tissue and body fluid have a get equilibrated in drug and considered as a separate compartment, means different compartment, and the body will comprise of infinite number of compartment and mathematical description of such model. Each and every body should have a different comprise and an infinite number of compartment, or we don't know how many compartment in that particular body. So just assume that how much or infinite number of compartment present in that particular body, and mathematical description of such model will be too complex. And then say you don't compare this model with some mathematical equation. If you check or use some mathematical equation, then it's a difficult to check these models, right? You check these models. So mathematical description of this level is too complex or not possible. Next is within each compartment, the drug is considered to be readily and uniformly distributed. Means each and every compartment you just consider that the drug is uniformly and rapidly distributed and the compartment is a balanced drug. Means it's also assumption if someone is taking drug or that particular drug taking a drug. In this you assume that your drug is uniformly and rapidly distributed each and every compartment, and compartment is a balanced drug, and the rate of drug movement between compartment, that is entry and exit, is described by first order kinetics. Means in compartmental model we generally consider or we consider the rate entry or exit of a drug or movement of a drug from entry to exit will depend on the first order kinetics or depend on first order rate. So the movement compartment is dependent on first order kinetics, and rate constant are used to represent the rate of entry into and exit from the compartment. Means the rate constant is also represent rate entry and exit from the particular compartment or particular that side. So this is depend on both entry as well as exit of the drug from particular compartment and movement of the drug. So the first order kinetics including entry and exit in this compartment. This is a mammillary model of compartmental model, subtype of compartmental model. In this mammillary model, there is 6 model, and according to different compartment, we classify the 6 model. First 2 are the one compartmental model, next 2 are the 2 compartmental model, and next 2 are the 3 compartmental model. Yes, these are the total 3 compartment, 6 model which have 3 compartment, 2 are single, then 2 and then 3 compartments. Now we compare this of how the model takes place. So we can see this in model number 1. In one compartmental open model, intravenous administration means you administer the drug intravenously in a one compartmental or single compartment. This is a model, and after administration, you can excrete out, that is K10. And this is a model 2. In this also one compartmental model, but instead of intravenous administration, you can give the drug by extravascular site, that is oral, rectal, or any other extravascular route. So this is also have one model. One compartmental model, this one, and there's also K0 elimination, and but you administer drug by extravascular, that's the administration or absorption of drug by extravascular, that is K01. Next in model 3, It is a two-compartmental open model similar to a first model, but in this there are two compartments. In one, there's only single compartment. In this, there's two compartments, first and second compartment. And in this also, drug is administered by intravenous and intravenous administration. So when you administer a drug, the drug is goes from first compartment to another compartment, and this is a reversible process. And the admission is at K10 by IV, but one compartment to another compartment is a reversible transfer of the drug. And next is two compartmental open model extravascular administration. It is also similar to third model, but instead of intravenous, you are administered by extravascular administration by extravascular side. So in this also two model, this one and this one, and it is also a reversible process from one compartment to another compartment. This one is K12 and this one is K21. And this is also elimination, but there is absorption which takes place because you are taking a drug from extravascular route or the different route other than IV route. So this is a two compartmental open model for extravascular administration. And next is fifth model. In this free compartmental open model intravenous administration. Next, in here is a three model, 1, 2, and this one is a three model. So there is a three model in this drug transmitted from one model to another model. It is a reversible process. In example, the first drug administered, and after this it goes to second compartment. It's also a reversible process. And after it goes to the third compartment, and it is also a reversible process. Means after administration, it goes to different compartment. In both compartments, it shows reversible process. That is K13 and K31 is return process. In the second compartment, K12 and K21 is a return process and has admission. So this is for intravenous administration, three compartmental model. Next is model number 6, that is three compartmental open model extravascular administration. This is also have a three model 1, 2, and 3. And this is administered by extravascular route, not by intravenous route. And in this also, the drug is administered or goes from one compartment to another compartment. And this is also a reversible process of transporting extravascular administration. In this one, because goes to 1, 2, and after coming in, it's 2, 1. And the third compartment, K13, and coming is 3, 1. So, and this is the absorption rate because of drug is going by extravascular route or other than intravascular route. So these are the mammillary 6 model or 6 model for this mammillary. So you can easily study this model according to the compartment. It's a single compartment, 2 compartment, or 3 compartment. And in this, the number of rate constant which will be appear in particle component metal is for intravenous administration rate is R is equals to n minus 1. This is a reaction for intravenous administration or when you administer drug by intravenously. R is equals to n minus 1, and for extravascular administration, R is equals to 2n, means other than intravenous or when they administered by extravascularly. And these are the two equations where n is the number of compartmental. So in n, you can check how much compartment present in your particular mechanism. So n is the number of compartment. And next is catenary model. In catenary model, there is 3 compartments, 1, 2, and 3, but these are arranged in a parallel. And in previous way, these are arranged in a series, but these models are arranged in a parallelly or parallelly. You can say this one is set to second one, second to third, and the transporting of the drug is also a parallel process or reversible process. When the drug administered, it goes to second compartment, that is 1 to 2, and then is 2, 1. And after the compartment 2, it goes to compartment 2, there is 1, 3, and then is 3, 1. And animation is K10. So this is the category model. In this parallel drug flow or parallel drug takes place for the showing the effect of the compartment are arranged in a parallel way. Next is physiological model. These are the model are also known as physiological based pharmacokinetic model. That is PBPK model, and they are on the basis of known anatomical and physiological data. Means this is based on physiological condition or physiological model, and in this mainly your data depend on anatomical and physiological data and present in more realistic picture of the drug distribution in various organ and tissue. Means how much represent in realistic way or how much represent particular organ and tissue and how it distributed out. All this checking this physiological model. And next is a number of compartment to be included in model dependent upon the deposition. Then some compartmental model is also model dependent, and therefore this model dependent is depend on the deposition characteristics of the drug, on the position of the drug, and the organ tissues such as bone have no drug penetration are excluded. Means all are have one example, and the penetration are excluded, and including bone. And this is all about the physiological model. Means this is mainly depend on physiological parameter or physiological condition, and as well as anatomical condition of patient, and realistic picture are the position by organ and particular tissue. How much drug is available for that particular organ and tissue, and the position takes place at that particular compartment, all which is by the help of this physiological model. This is a diagram of physiological model. So it is a kind of physiology anatomy and different some tissue. And in this one is lung, 7 is heart, then gut, then liver, kidney, HPT, or PPT. These are the different organ sites where this physiological model is studied. But the accumulation and passing of the depend on the high perfusion rate of particular organ. In this lung, it first goes and it goes granules in blood and arteries in the blood, and in second gut, after that it goes in the liver and elimination takes place. Then kidney in this after elimination takes place in kidney. HPT is QHPT, PPT, LQT. These are the example, or this is the diagrammatic way of this physiological model. And after this physiological model, next we discuss the another part of this physiological model. In this physiological model are further characterized in the two type. Means this physiological model also have two different type or two category. In this blood flow rate limited model is the first model. This model are popular and commonly used for second type, and based on the assumption that drug movement within the body region is much more rapid than its rate of delivery to the region of perfusion. Blood means all this parameter of this blood flow rate limited model depend on blood flow rate or how much blood flow that particular organ or particular tissue, or assumption of drug movement from the region, and it have a more rapid and rate of delivery to the region perfusion is high. In this mainly check the more popular and commonly used second type, and based on the assumption that drug movement within a body region, how much drug move in a particular body or body region is just more rapid than its rate of delivery to that region by perfusing the blood. And these models are therefore called as perfusion rate. Means another name of this blood flow limited model is perfusion rate, because blood is perfused for that particular organ, and perfusion is takes place in this route. And it is a perfusion rate limited model, and these assumption is not applicable only to the highly membrane permeable drug or those drugs who have a higher permeability, because these model is not good for all type of the drug. It is majorly available or good for those drugs which have a high permeability and low molecular weight or poorly ionized. Means this blood flow rate limited or this perfusion rate limited model is mainly for those type of drug who have a low molecular weight or small size of molecular weight or poorly ionized, or ionized is also poor in condition, and high lipophilic drug. And in this example of these category drug is thiopentol and lidocaine are the example. These drugs are show pharmacokinetic parameter by blood flow rate diffusion model by this model. Next is membrane permeation limited model. In membrane permeation limited model is the second model. These models are more complex and applicable to highly polar, ionized, and changed drug. Means this is for also specific drug or only for those drugs which are in a complex nature or having highly polar in nature, or polar drug or ionized as well as charged drug. and in which case the cell membrane acts as a barrier for the drug that gradually commit by diffusion. Means the cell membrane is act as one barrier, or with the help of the cell membrane. Now, not all drug are passes through it's one barrier, and there's a barrier that gradually commit the drug by diffusion. Now, slowly a drug that commit through this membrane or allowed to commit through this membrane by the diffusion process. And in this model are therefore also called as diffusion limited model. So another name of this membrane permeation rate limited model is a diffusion limited model, and owing to the time we lag in equilibrium between the blood and tissue equation for these model are very complicated. Means check the timing or owing time in the equilibrium between blood as well as tissue. For this model it's very difficult, and with the help of equation you can check, and this is a complicated model, and this is also a diffusion limited model. And this limitation of a drug for this model is that the drug should have bipolar, ionized, and charged drug, and easily cross the barrier. If some drug are not crossed, these will be gradually formed by diffusion or diffusion model. Next is non-compartmental model. So we discussed, we already covered a compartmental model and two different types of this compartmental model. Next is a non-compartmental analysis or non-compartmental model. The non-compartmental analysis is also called as model independent method, and that does require the assumption of specific compartmental model. Means this is maybe non-compartmental model, but it requires some specific assumption or some specific condition of a compartmental model. Or these method is however based on the assumption that drugs are metabolized or following linear kinetics, and on this basis, this technique may be applicable or any other compartment. Means this is a non-compartmental model, but some assumption or some consideration is dependent on similar to compartmental model or dependent method, and does not require assumption of specific compartmental model. And these methods are however based on the assumption that drugs are metabolized and follow linear kinetics. Means in this non-compartmental model, the drug can follow non-kinetics or non-linear kinetics. This basis, this technique is applied for like any compartmental model. And non-compartmental approach in statistical movement theory involves a collection of experimental data following a single dose of the drug. If one consideration, the time course of the drug concentration in plasma and statistical distribution curve. Means we can also see that the non-compartmental approach or statistical movement theory, collection of experimental data and single dose of drug is available, and if you consider the time course of the concentration in plasma and statistical distribution curve is formed, and in this MRT we calculate with the help of MC and AUC. These parameters we already discussed in previous lecture with the help of activation, and you also calculate MRT mean the severe time. AUMC is the area and the first movement curve, and A is the area and the zero movement curve. So in this non-compartmental model, simply we can see that MRT is equal to AUMC divided by AUC, and you know about these full form of these parameter. MRT is the mean residence time or mean residence time, and AUMC is the area under the first movement curve, and AUC is the area under the zero movement curve. So these are the some parameter for this equality, and MRT is defined as the average amount of the time spent by the drug in the body before being eliminated. Means how much maximum time is spent or how much average time is spent in the body before it being eliminated or removed from your body. So this is non-compartmental analysis. This is a graph of concentration versus time. In this, in one axis you plot the time, in another is the concentration. So unit is concentration versus time, and in this is the AUC, and this is trapezoid for C1, C2, and C3 and C4 formulation of the rate of this water. And this is another AUMC for another drug, and you see this AUC is a formula for T2 minus T1, and in brackets C1 plus C2 divided by 2 for this AUC of trapezoid area. And next formula is for this side, that is AUC in this T4 minus T3 in bracket C3 divided by 2. This is the second formula. Next is the pharmacokinetic parameter or pharmacodynamic parameter. Now we discuss different parameters. The information regarding this pharmacokinetic and pharmacodynamic parameter, which are the parameters involved for this compartmental model. In this pharmacokinetic model, first model is a peak plasma concentration or Cmax. So this model is also known as Cmax or peak plasma concentration model. And the point at which maximum concentration of the drug in plasma in unit means how much maximum concentration of available drug or how much maximum drug is available in the plasma or peak plasma concentration. And unit of this Cmax or peak plasma concentration is micron per ml. This is the unit. And peak concentration related to intensity of pharmacological response. This should be above MEC, maximum effective concentration, but less than MS, maximum safe concentration. Means that this peak concentration is the Cmax, and the name of peak plasma concentration is Cmax. It should be maximum, and it should be above MEC, but it should be less than MSC or maximum safe concentration, or above that minimum effective concentration. And the peak level depends on administration dose and rate of absorption and elimination. Means this figure is dependent on the peak level of these graphics depend on the administration dose and rate of absorption and elimination of the drug. So this is the peak plasma concentration. Next is the time of peak concentration, that is Cmax, means how much time is required to show the concentration or maximum concentration. Previous parameter. So this is regarding the time, Pmax or maximum time for peak plasma concentration. And time for drug that means the peak concentration in plasma after extravascular administration. Then you check how much time is required, how much time is taken by that particular drug to reach that particular point or maximum plasma concentration after administering the drug by extravascular administration. And the unit of this peak plasma concentration is an R. And useful in estimating onset of action and rate of absorption. Means in this you check the estimating onset of action or how much effect is produced in that particular absorption time or that particular effect. And importance in assessing the efficacy of a single dose drug used in treat acute condition of pain or insomnia. Means this is mainly you see the how much time is required to show the effect or reach to onset of action and rate of absorption. And this is a check for efficacy of a single dose drug or single drug formulation and treat the acute condition like pain, insomnia with the help of this peak plasma concentration. So this is the time for peak concentration. The next parameter is the area under the curve. This is a very important parameter for pharmacodynamics or AUC. And in AUC, it represents a total integrated area under the plasma level time. Means how much time or how much consider or taking the effect or required effect for that particular area or plasma level time profile, and express the total amount of the drug. Means how much drug or total amount of drug is comes in the systemic circulation after administration. So with the help of this AUC area under the curve, we check the effect or maximum concentration of the plasma in your blood or plasma level time profile, and express the total amount of the drug or how much total drug is comes in the systemic circulation after administration or after taking the drug, how much total drug is found in the blood. And unit of this AUC is UG per ml into R. This is the unit of the area under curve. Next, in this, the present extent of absorption. In this, evaluating the viability of a drug from its usage form, means you check how much extent absorption available or viability of a particular drug from the usage form, means how much viable drug is available. Viability of a drug means how much drug is available to show the effect and in this particular dosage form. And important of a drug administered repetitively for treatment of chronic condition, asthma or epilepsy. Now, the important parameter of this is also that how much drug is administered or repetitively administered by the chronic condition by that particular condition. In this example of condition is asthma and epilepsy, the example. Area under is calculated, means how much total drug available in your plasma in your circulation. With the help of this AUC graph, we calculate this maximum concentration of the drug. Next is pharmacodynamic parameter. This is the pharmacokinetic. Now we discuss about pharmacodynamic parameter, different pharmacodynamic parameter, which is also responsible for this pharmacokinetic model. So you should know about this pharmacodynamic parameter. And in this pharmacodynamic parameter, first parameter is MEC, that is minimum effective concentration. So minimum concentration of a drug in plasma and the subtle site required to produce the therapeutic effect means how much drug is required or minimum effective concentration. Means starting of the drug or showing the response of the drug, there is a minimum effective concentration. In this, you check how much drug concentration is required, how much drug is used to show the minimum concentration of the drug in plasma or that particular receptor site to produce the therapeutic effect or produce the desired pharmaceutical effect. Next is concentration minimum MEC or minimum effective concentration, subtherapeutic level. So this is the subtherapeutic level of MEC. And antibiotics is majorly used to check the MEC, effective concentration. Next is the maximum safe concentration or MSC. So when we see the maximum safe concentration is the amount that almost complete therapeutic effect or required effect is observed, but more than that level or more than that concentration, if your drug still shows the effect, then this level is known as maximum safe concentration, or above this some side effect or some adverse or unwanted effect are observed. So this is the last level or last concentration of the maximum safe concentration of showing the therapeutic effect. And in the MSC or maximum safe concentration, the concentration in plasma above which adverse or unwanted effect are precipitated or observed, means above that particular level, the side effect and unwanted effect start producing is known as maximum safe concentration. And concentration above MSC show the toxic level and toxic effect. So this is the maximum safe concentration and minimum effective concentration, and these parameters come under the pharmacodynamic parameters. Next, in this pharmacodynamic parameter, onset of the time means how much time is required to show the particular effect or onset of action of the drug. And in the onset time required to start producing pharmacological response, and time for plasma concentration to reach MEC after administering the drug means how much time is required to show the pharmacological response or complete response. And in this plasma concentration, and we check to reach how much time is required to show the maximum effect in plasma concentration after administering the drug. Means this is nothing but the time which is required to show the pharmacological response of pharmacological effect of that particular drug after administering or amount of drug present in plasma concentration. Next is onset of action. In the onset of action, the beginning of pharmacological response means starting of the pharmacological response or onset of the action. We check in this, and it occurs when the plasma drug concentration just exceed the required and exceed minimum effective concentration. Means this onset of action is majorly observed or seen after MEC or minimum effective concentration. And in this, you can say that this onset of action is the beginning of pharmacological response and starting of a pharmacological response. And next is the duration of action. And this duration of action, the time period for which the plasma concentration of the drug remains above MEC, minimum effective level, means how much time or duration is required to show the minimum effective concentration on plasma concentration effect of the drug. So this duration is known as duration of action for MEC level. And next is intensity of the action. In this, you know about the how much intensity or how much effect of that particular drug is observed. And in this intensity of action, there is a minimum pharmacological response produced by peak plasma concentration of the drug. So in intensity of action, you can say that this is the minimum pharmacological response or less pharmacological response observed by peak plasma concentration of the drug or by the peak formed by this AUC graph. So this is regarding the peak plasma concentration of the drug or minimum pharmacological response of the drug. Next is the therapeutic range. This is also next parameter, pharmacodynamic parameter. In the therapeutic range, the drug concentration between CMMSC, is minimum effective concentration and maximum safe concentration. Means between these two parameters, how much drug or how much dose is present is known as therapeutic range. Or you can say that when your drug starts showing effect is known as minimum effective concentration, or starting of a drug concentration showing effect is known as minimum effective concentration. And after at particular point, it show almost complete effect or desired effect. So this is called as maximum safe effect. After this, it show more toxic effect or unwanted effect. So this is known as MSC. So between these and EC, minimum effective concentration or maximum safe concentration time, effect of this parameter between these parameters known as therapeutic range, or blood concentration present between these two parameters is also known as therapeutic range. So next is the concept of a half-life. In this half-life, how much time it takes the blood vessel of the drug to decrease the half, or what it is an equilibrium. Half-life name itself say that it is a half time or half T required to take the blood vessels of the drug to decrease in a half, or what is an equilibrium, how much represent in a half time period. And they are really to one half-life. Distribution half-life is the plasma level fall to half when what they were at equilibrium due to distribution to storage in a body tissue reservoir. Next, this distribution half-life is also known as when plasma level fall start and when they are equilibrated to distribute or to store in your body in a reservoir. So if this parameter is observed, then it is known as distribution half-life. And next is the elimination half-life. So this elimination half-life when the plasma level falls to half when they were equilibrated due to metabolized elimination and eliminated. And this is usually after this distribution half-life. Next topic is elimination half-life. In elimination half-life, when the plasma drug fall to half, that we are equilibrium due to drug being metabolized and eliminated. Name itself say that this is regarding the elimination, or you check how much drug get eliminated, half of the drug eliminated, or half-life of that particular drug. So in when plasma level fall to half, what they were equilibrated due to drug being ionized or eliminated, means how drug ionized or being eliminated in this check, or how much half elimination time is required to eliminate out, or elimination rate of that particular drug. In this, you include both metabolism and elimination process, means both metabolism and elimination is responsible for this elimination half-life. And it is usually the elimination half-life that is used for determining the dosing schedule to decide when it is safe to put patient on a new drug. Means this elimination half-life is also important to check the dosing schedule or dosing interval of the formulation, or you check or decide that this is a safe or not, or you can use these dosing interval for patient or checking the particular dose formulation for a new drug for particular patient. So this elimination half-life is also used or determine the dosing interval or dosing schedule of your formulation to decide when it is safe or not, or for to patient of a new drug formulation. Means these parameter is also important for determining the new drug formulation parameter or study of a new drug formulation to check the dosing interval or dosing schedule of your formulation of a new drug. So this is regarding the concept of a half-life, including distribution half-life and elimination half-life. After this is next is learning outcome topic, and in the learning outcome, these are the learning outcome. In this, after completing this topic or completing this lecture, you should know about these are the basic outcomes or learning outcomes. We already discussed different pharmacokinetic model. In this, the subtypes of a pharmacokinetic model, including different parameters of pharmacodynamic and pharmacokinetic. These are the parameters. So these are the learning outcome. In this learning outcome, first is the introduction of a pharmacokinetic model. Means what are the pharmacokinetic model, the description of a pharmacokinetic model, all complete information regarding the pharmacokinetic model. And next is a different pharmacokinetic model, including compartmental and non-compartmental model. In this, we see that there's a compartmental model, a non-compartmental model, and these compartmental and non-compartmental models further divided into different categories. So you should know about the subtypes of this compartmental and non-compartmental model, or subcategory of this model, and the subtype or how you use this model for that particular study, and subtype and example of this model means how we perform this study. And after this outcome, this is a reference part of this topic or compartmental model. This reference is sufficient for this pharmacokinetic parameters, including compartmental model. In reference part, first is of biopharmaceutics and pharmacokinetic, P. L. Medan, first edition. Second is a biopharmaceutics and pharmacokinetics, D. M. Bhamankar and Sunil B. Jaiswal, first edition. Next reference is applied biopharmaceutics and pharmacokinetics, Leon Sargil and Edrivio, fourth edition. And next is a biopharmaceutics and clinical pharmacokinetics, Willow Vivaldi, fourth edition. And these are the some link: www.google.com, www.books.google.com. So these are the all good references. You can any one of references or in a combination or all references for good content or for complete study including equation or methods of this pharmacokinetic model. So these are the all references regarding this pharmacokinetic parameter, including the different models or subtypes of this model. And next is a question part. After completing this reference part, we discuss the question part of this topic or questions related to this pharmacokinetic and model topic. If you know the complete information regarding this pharmacokinetic, dynamic, parameter, and model, then you can easily answer this question. And in question part, first question is the half-life is a time required to change the amount of a drug in plasma by half during the elimination, and in the option metabolize the half of introduced drug into the active metabolites and absorb a half of introduced drug, and D option is a bind a half of introduced drug in plasma protein. Means in this you know about a half-life. Half-life already we discussed, so you should know about what is a half-life. According to half-life time is required, you can choose any one correct option out of this ABCD option. In this A option is how much change of amount that particular for half duration of elimination, and second is metabolism of a half for introduce drug in active metabolites, how you introduce this metabolized drug halfly. And next is absorb a half of the introduced drug, means how this absorb this introduced drug or half absorb drug into the drug. And last is bind a half of introduced drug to plasma protein, means how binding drug is how to introduce in plasma protein. So this is the first question. In next question, half-life does not depend on. So these are the parameter or ABCD option. In this, you select any one correct option, which is not affect the half-life or not affect the half-life of your drug or half condition of your drug. In this, there is a biotransformation. These are time of drug absorption. These are concentration of a drug in the plasma, and these are rate of drug elimination. So these are the four options. In this, you select any one correct option which is not suitable or incorrect for half-life. So out of this, you can select any one correct option. Next, in third, in a one compartmental open model, the term open indicates input and output are. So this is a one compartmental model question or question related to one compartmental open model. In this, you should know about what is the input and what is the output. Input means when you take the drug or administer the drug. Output means elimination rate or metabolism rate or excretion of the drug throughout your body. So in this one compartmental open model, you should know about this now. What is input and output indicates. In this is a unidirectional option. D is a bidirectional, C is a non-directional, and D is tridirectional. These are the four option or ABCD option. You can select any one correct option which is appropriate for one compartmental open model for input and output. Next is the fourth question. In this linear pharmacokinetics, also referred as first order kinetics, B is a second order kinetics, C is pseudo order kinetics, and D is a third order kinetics. So these are the four terms or four options according to kinetics or rate of kinetics. In this, you select any one correct option which is suitable for linear pharmacokinetics. So which is suitable or which is appropriate for linear pharmacokinetics, including four options ABCD. Next, fifth question is a mathematical concept which describes space in the body, which a drug appears to occupy is order of reaction. A option B is compartmental, C is distribution, and D is elimination. In this, you know about what is a mathematical concept or drug to appear in your body, and according to this mathematical concept, you can select any one correct option for this fifth question. In this, maybe it's order of reaction, maybe compartmental base, or maybe distribution or elimination. Next, in sixth question, the manner in which drug is taken. A option is a dosage regimen, B is a dosage volume, C is dosage loading, and D is a dosage region. Means what manner or what sequence is required for taking the drug, or when you taking any type of the drug, this sequence is followed. Out of this ABCD option, you can select any one correct option regarding the dosage taking or dosage regimen of a formulation or a particular drug. Next is seventh question. In this part will be found in which compartment in multi-compartmental model. We already see the different multi-compartmental model. More than one compartment is known as multi-compartment. When you take maybe IV bowler, IV infusion, or maybe extravascular route. So heart come in which multi-compartment? You answer the one correct answer of this four option ABCD. In this, A option is a peripheral compartment, B is a central compartment, C is a both compartment, and D is a semi-peripheral compartment. Next is the eighth question. AUMC is, these terms we already discussed, including the abbreviation and units. So you should know about what is this AUMC. So there's a four option regarding the full form of AUMC. And A option is area under the curve. B is the area under the zero movement curve. C is the area under the forced movement curve. And D is the area under the third movement curve. These are the four options for AUMC. Which one is correct to select out of this ABCD option, which show the correct option or full form of this AUMC. Next, in ninth question, pharmacokinetic is the study of a biological therapeutic effect of the drug. Means pharmacokinetic include which study or which parameter. We already discussed this question also, pharmacokinetic definition, description, and the different parameter. So you should know answer of this question. Of this ABCD option. In this, A option is the study of the biological and therapeutic effect of the drug. B is the study of absorption, distribution, and metabolism and excretion of the drug. C is the study of the mechanism of a drug action. And D is the study of a method of a new drug development. So these are the four options regarding the pharmacokinetic, which is correct or suitable for pharmacokinetic. You can select out of this ABCD option. And last 10th question is, what does pharmacokinetics include? In this, A option is complication of a drug therapy. B is the influence of a drug on metabolism process. C is a drug biotransformation in the organism, and D is the influence of a drug on gene. So these are the four options regarding this 10th question or regarding the pharmacokinetics include. Means pharmacokinetics, which parameter include, or in pharmacokinetics, which you include. So these are the four options for regarding pharmacokinetic. You can select any correct option for this question. So these are the question parts which is related to this topic, pharmacokinetic model, including the description or introduction part. You can answer this question easily if you know this topic completely. So thank you so much for watching and listening this video. Thank you.